Professor Dr. Walid Farag. Predictability of outcomes in delayed cochlear implant in post-lingual sensorineural hearing loss.
Okay, thank you, Mr. Chairman. Thank you for the organizing committee to invite me. Actually, this is quite a short presentation aiming to deliver a very short message. All right, so what's the background that I performed this research for? It's the concept of the grace period for cochlear implant in post-lingual sensorineural hearing loss. I think we are taught since we were young doctors that you have a period of a few years since losing your hearing so that you can benefit from a cochlear implant. And this period was a little bit flexible from just a couple of years, and we reached up to 10 years. And then the old teaching is that if you have a patient that has lost his hearing for more than 10 years, don't expect him to benefit that much from a cochlear implant because the brain has somehow forgotten the input that will come from this ear that is going to be implanted. But is that true or not true? And is it equal in all cases? Is it equal between one patient and the other? Is it equal between a bilateral and a unilateral hearing loss? That's what we're going to just highlight the next few slides. So, okay, so the brain activity is measured by functional magnetic resonance imaging. That's how we're going to test this theory, is that are you going to use it for short or long-term cochlear implant patients? All right, so the brain activity is measured by functional magnetic resonance imaging and functional near-infrared spectroscopy. And also, the diffusion-weighted imaging will measure the brain's white matter integrity. How is this going to affect our conclusions to what yes or no implant or don't implant? A long duration of deafness prior to implantation is generally detrimental to performance. That's an agreed upon statement. Everybody agrees upon that all through the past 20 years or 25 years since cochlear implant was initiated actually for postlingual patients first, and then it went down through the years. But it has been shown that the auditory experience can improve clinical performance of cochlear implant users. All right. However, individuals with remarkably similar hearing experiences can often have markedly different speech comprehension skills. And how is that elaborated? While a number of factors that influence the clinical performance of cochlear implants have been identified, the field currently lacks accurate predictors of cochlear implant performance that can be applied to an individual. Such a prognostic tool could help direct limited healthcare resources. If we have only limited resources and we have two patients, which of them would I give the chance, okay, you're going to have some benefit from this cochlear implant, or your benefit is going to be very limited, so I'm not going to choose you. So what we're going to do is a cross-modal, address the cross-modal reorganization in the deaf brain. What happens? Let's say this patient is having a progressive hearing loss. He's losing his high frequencies and he's retaining his low frequencies. What will happen is that these low frequencies will be redistributed over the areas of high frequencies so that he has still some benefit from his hearing and he will still have some speech discrimination even though he has lost the higher frequencies due to reorganization of the cortical areas in the brain. So the animal neurophysiology has demonstrated that when sensory neurons lose their input, such as vision or touch or hearing, they do not become silent. Instead, they change their responsiveness. In case of noise-induced sensory hearing loss, high frequencies, as I said before, previously responding to high frequencies, respond to low frequencies, okay? How about in case of a complete hearing loss, what will happen is that something will happen, some other function will take over hearing. Either it's vision, either it's proprioception, either it's touch. Something will take over this area in the brain. It will have cross-communication with it, and it's going to take over the area that should have been dedicated to hearing. So, cross-modal reorganization refers to the takeover of processing of sensory information using new cortical pathways. What I'm going to say is that some people with congenital hearing loss show supranormal visual abilities. Why are they showing supranormal visual abilities? The temporal area that should have become dedicated for hearing is being taken over by the visual area, okay? So it's not clear whether this rewriting is beneficial to hearing in cochlear implant. If I'm going to implant the patient, will this cross-modeling become reversed? Is something going to come back? Is this area that has been overtaken by visual or proprioceptive or touch come back to hearing? It's quite unclear. So do we have a tool to determine if this is going to be a functional candidate for cochlear implant or no? The main thing that we're going to do is a PET scan to examine the resting stable brain activity in prelingually deaf individuals. And if we find hypometabolism in the cortical areas that are responsible for hearing, that's the temporoparietal area, if it's going to be hypoactive, not hyperactive, hypoactive, it's not illuminating in the PET scan, that means it's not being taken over by other functions like vision or proprioception or touch, so that's going to be a good candidate for a cochlear implant. This is the area in the functional MRI that we're looking for. If it's dull like that with minimal activity with the PET MRI, that's a good candidate for cochlear implant, whatever the duration of hearing loss. And some studies have performed post-lingual hearing loss up to 30 years from hearing, and have had very good results when this was the PET MRI for him. But if you find the PET MRI like this is a normal PET MRI with a patient with normal hearing. These are the areas that have become illuminated with auditory stimulation. If you find that these areas are illuminated with something other than hearing, you don't find this picture, you find this picture with stimulation other than hearing, that means that he's going to have very poor outcome with a cochlear implant, and this is very rarely reversible. Okay? So the issue is, if you're going to have a cochlear implant with limited resources in a patient that has had post-lingual sensorineural hearing loss for a prolonged period of time, and you want to determine, am I going to benefit or not benefit, please do a PET MRI, a functional MRI, to determine if the temporoparietal area is functional, hypo-intense or hyper-intense with the glucose uptake. If it's hypofunctional, that's a good candidate. If it's hyperfunctional, it's not a good candidate. Okay, so thank you very much.